Hi there, this is Love Johar. Thank you so much for tuning into this video and thank you so much for watching this channel. In this video, we will try to understand what is Health Insurance Portability and Accountability Act, HIPAA, and what is Health Information Technology for Economic and Clinic Health Act. Okay, so very important to understand the difference, and we will also understand a case scenario where we will discuss these in detail. So please watch carefully and let me know if you have any follow up questions. If you are working in the GRC domain, governance, risk, and compliance, and if you are working in the healthcare sector, this video will be very helpful for you. If you wanted to understand what is HIPAA, what is HITECH, and what is the difference between them. So please watch this video very carefully. It will help you in a long term. Okay. So first of all, let us understand what is HIPAA. So HIPAA is basically nothing but a law which is protected to create your healthcare information. Okay. So any sort of healthcare information, for example, your medical records, your different sort of X-rays, different sort of any sort of healthcare information, if you have, so it is being protected by HIPAA. So it's a law. Okay. Why it is important? It's important because it ensures that your medical records and personal health information are kept private and secure. So in order to maintain a privacy in the healthcare sector for your data, which is protected health information which you have, and in order to make sure that these documents are kept sensitive and private and secure away from the reach of public, so that nobody can access them. That's why you have a law which is created to protect your healthcare information known as HIPAA. Okay. So what does it do? So HIPAA basically gives you set of rules, set of guidelines for healthcare providers who are actually trying to retain this information, and healthcare organizations about how they can use and share your healthcare information. Okay, so any sort of information they have, okay, they have to ensure that they follow strict protocols about sharing your healthcare information with any other individuals or parties. Okay, it also gives you rights over your own health information. Okay, for example, you can also see the copies of your medical records, and you can also ask for them. Okay, and you have to make sure that doctors, hospitals, and insurance companies can only share your health information for specific regions. So they have to be very specific when they are sharing your medical records with any other third parties. Okay, and it basically sets out security standards so that your healthcare records are kept safe, especially when they are stored on computers, because these are electronic informations, so electronic records. So they have to be governed by some sort of security standards. Those standards are set by HIPAA. Okay. So who enforces HIPAA? So HIPAA is basically enforced by the Office for Civil Rights (OCR) within the Department of Health and Human Services (HSS), making sure that the healthcare providers follow HIPAA rules. There are HIPAA rules. There are different videos on this channel where we have actually discussed all the HIPAA rules in detail. There are many videos. Please feel free to search them and watch them. Okay. Now coming to the other part, which was never discussed before, which is high tech. Health Information Technology for Economic and Clinical Health Act. Okay, so what is this? So HITECH is basically a law which encourages all the healthcare providers to use electronic health records and other technologies to improve healthcare. Okay, so it basically emphasizes for using electronic records so that the healthcare information can be saved more efficiently, accurately, and it is safer for patients as well. So it basically provides incentives to all the healthcare organizations, to adopt electronic health records and meet certain standards for using them effectively. Okay, it also makes easier for different healthcare systems to share information electronically, which can improve coordination of care. So the reason why it actually wants to emphasize all the healthcare providers to start using electronic records is because of the sharing of information, which can become very easy between different organizations, between different healthcare hospitals, or different healthcare providers, insurance companies, etc. So in order to make sure that there is efficient sharing of information, you actually have HITECH in place. So HITECH is enforced by Centers for Medicare and Medicaid Services (CMS) and the Office of the National Coordinator for Health Information Technology (ONC), which oversees the adoption and use of electronic health records. So, in nutshell, so far, if we see what is HITECH and what is HIPAA, so HIPAA basically focuses on keeping your health information private and giving you control over it. Okay, what sort of medical information does the healthcare provider has on you? Okay, while HITECH is basically encouraging all the healthcare providers to use technologies like electronic healthcare records to improve the quality and efficiency of the healthcare. So objectives are different. You can clearly see that. Now let us understand more with a case scenario so that you can get more clarity. Okay, so privacy scenario is, imagine you visit your doctor for a routine checkup. During the visit, your doctor records information about your medical history, your current medications, and the results of any tests or examinations. After the appointment, you receive a prescription for a new medication. Okay, so HIPAA ensures that your personal health information, including details about your medical conditions, is kept private and secure. For example, your doctor's office must have policies and safeguards in place to prevent any sort of unauthorized access to your medical records. Only authorized individuals, such as the healthcare providers involved in your treatment, should be able to access the information. Okay, so in this case, your doctor's office should have, okay, secure systems in place to store your electronic medical records. Okay, and it should also have access to these records being restricted to only limited people who are healthcare professionals only, who are directly involved in your care. This is very important, who are directly involved in your case. Okay, so when you request a copy of your medical records to share with another healthcare provider, the office ensures that the information is securely transmitted to maintain confidentiality. So this is how HIPAA acts in this case. Okay, when you visit a doctor. Now, what is the role of HITECH here? So HITECH, as it encourages the use of healthcare providers to use electronic health records. Okay, so it includes functionalities such as electronic prescribing, lab result tracking, and secure messaging between healthcare providers. So in this case, your doctor's office has transitioned from paper-based records to electronic health record system. So during your visit, your doctor enters your information directly into the electronic health record system (EHR), including your medical history, your current medications, and treatment plan, etc. So this electronic system allows for better organization and accessibility of your health information, reducing the likelihood of errors associated with handwritten notes. Okay, and improving communication between healthcare providers. So in nutshell, if we see a difference between HIPAA and HITECH, I can clearly say that HIPAA is overall responsible for making sure that your healthcare information is kept private and secure. HIPAA is taking care of that. However, in order to make it possible, again, you need to have HITECH in place, because otherwise, if you have paper based records, it would be very hard even for HIPAA to control all the paper based information as well. So HITECH is playing a very critical role over there, if you see, in order to make sure that all the healthcare information is being transmitted only in electronic form. Okay, not in paper based form. So I think both of these are very important, and you should be aware about them. Anybody can ask you in the interviews. Again, any follow-up questions, anything you want to add in the comment, feel free to add in the comment section. Thank you so much for watching. Take care. Bye bye.